Have you ever stopped to think about how a child with diabetes can go through surgery safely? It sounds incredibly complex, right? But thanks to some amazing planning, it's become a routine part of care. Today, we're going to pull back the curtain and look at the clinical guidelines that make it all work.
So let's just start with the big question right up front. How in the world do you keep a child with diabetes safe during a surgical procedure? Well, answering that means we've got to dive into some pretty delicate body chemistry and, you guessed it, some seriously meticulous planning.
Okay, so the core of the problem is this massive balancing act. On one hand, surgery requires fasting, no food. That can make a child's blood sugar plummet, which is super dangerous. But, on the other hand, the physical stress of surgery itself can cause blood sugar to spike, which is also really dangerous. So the medical team is literally walking this tightrope the entire time. So how do they manage that tightrope walk? Well, there's no single one-size-fits-all answer. Instead, every single care plan is a custom blueprint, and it's built using 4 key factors that tailor the whole approach to that specific child.
First up is the most obvious one. How long is this whole thing going to take? Are we talking about a minor surgery that's under 2 hours? Or is this a major procedure that's going to last a lot longer? The length of the surgery and the fasting that goes with it is the first big piece of the puzzle.
Next, the team has to know the child's daily routine inside and out. Are they on multiple daily injections, or do they use an insulin pump? And this isn't just a small detail, it's absolutely fundamental. The child's normal everyday regimen is the starting line for every single adjustment the team is going to make. Now, this is where it gets really fascinating. Something as simple as the time of day can change everything. A morning surgery has a totally different game plan for fasting and insulin compared to a procedure in the afternoon, which might actually allow for a small, careful breakfast. It's that specific.
And finally, the fourth factor. Was this planned for weeks, or is it an emergency? You see, a planned elective surgery gives everyone time to prepare and dial things in perfectly. An emergency? That changes the game completely. It's all hands on deck to get the child stable before they can even begin.
All right, so with those 4 factors in mind, let's walk through the most common situation, a planned minor surgery. The philosophy here isn't to reinvent the wheel. It's all about making small, really smart tweaks to the child's routine that they already follow every day.
So here's what that plan actually looks like. The night before, the long-acting insulin dose is usually dialed back a bit, maybe to about 75%, just to prevent their sugar from going too low while they're fasting. Then, the morning of, they might get a tiny, carefully calculated dose of fast-acting insulin. From there, it's all about monitoring, checking their glucose every hour. And the best part, as soon as the child is awake and can eat again, they can usually hop right back onto their normal home routine. It's a beautiful example of proactive, gentle management.
But what about when the stakes are higher? For major surgeries or in an emergency, the whole strategy has to shift. We move away from those proactive adjustments and into a system of incredibly precise, real-time control.
And the main tool that used to get that control is something called an intravenous insulin infusion. The easiest way to picture this is to imagine an expert who can adjust the insulin dose every single minute. That's what an IV does. It delivers a tiny, continuous trickle of insulin right into the bloodstream, giving the medical team amazing, second-by-second power to react to any changes.
And if you want to know just how precise we're talking, get this. A typical starting rate for that IV infusion is just 0.02 units of insulin per kilogram of body weight per hour. It's an unbelievably tiny and exact dose. It just goes to show you the incredible level of focus it takes to keep that child's blood sugar perfectly in range.
So when you put it all side by side, you can really see the 2 completely different philosophies here. For a minor surgery, the plan is proactive and gentle, making smart adjustments to their normal shots with hourly checks. For major or emergency surgery, it's all about precise, real-time control with that continuous IV and constant, intensive monitoring. 2 different challenges, 2 perfectly crafted solutions.
So after digging into all these technical details, what's the big picture? What's the real story here? It's that this is, at its heart, a story about teamwork. It takes a huge, dedicated, collaborative team to navigate all this complexity and make sure every single child has a safe outcome. And that team is big. You've got the endocrinologist, the surgeon, the anesthetist, specialized nurses. But, and this is the most important part, right in the center of that whole team, you have the patient and their family. They aren't just bystanders. They are active, essential partners in this entire process.
There's a quote that just nails it perfectly.
In pediatric diabetes care, meticulous planning and teamwork turn a complex challenge into a safe and routine procedure. I mean, that's it right there. It's that combination of expertise and communication that creates safety out of complexity.
Which really just leaves us with one final, bigger thought to chew on. When you see this level of care, a plan that's tailored to a person's insulin regimen, the time of day, the exact procedure, what does that tell us about where the future of personalized medicine is heading?